Laptops are definitely a very bad culprit because we're hunched over like that.
Yeah, it's a nice deep squat you're doing there, Mark.
People who have back pain actually have quite a strong active core because it's protecting your body from moving in different ways.
Key thing is early intervention, getting that advice early.
So these exercises, they do make a difference, even to people who are super fit. Hello and welcome to Inside Health. For this episode, you'll be joining me in our virtual back pain clinic. Together, we'll go through the practical steps that you can take to prevent, treat and manage back pain. Up to 84% of adults will suffer with some form of back pain in their lifetime. And that can feed into a long-standing belief that back pain is inevitable, hard to shift, or both. Now, I've suffered with back pain myself for years, so I really do understand just how frustrating it can be. But we want to show you that for the vast majority of people, managing back pain is possible. Here's what's coming up. Musculoskeletal specialist Rebecca McCulloch will talk us through assessment and diagnosis and explore some treatment options. Next, we'll explore how you might come back from back pain, as our guest Jenny shares her recovery journey, and we'll also bust a few myths. After that, it's time to get moving with a rehab session. Our physiotherapist Marco Peluso will demonstrate some easy, accessible stretches and strengthening exercises. And then finally, we'll be answering as many of your questions as we can. You can ask anything that you like in the chat and we'll do our best to fit it in. Let's start with the basics. So what causes back pain in the first place? To answer that question, I'm joined by Rebecca McCulloch. Rebecca is a highly experienced Bupa MSK case manager and specialist. Every day, she advises people on the best course of action for their back issues, supporting them on everything from self-management and exercise to consultant referral. So Rebecca, thank you so much for joining us today. I can see you've brought an interesting bit of kit here with you, so it's not going to be a full-on anatomical session, but I think it is helpful for people to be able to visualise the spine so that they can understand a little bit more of what's going on. So can you talk us through the different parts of the spine?
So I think this is the top of our spine. We actually have three main sections in the back, or the spine. So we have the top section, which is your neck, so that attaches just to the base of the skull just here. Then we have the middle section of our back, which is called our thoracic spine. We have 12 vertebrae in there. We have the very bottom bit of the back here, which is our lumbar spine, and we have 5 different vertebrae there. And then the spine actually attaches into the pelvis. So you see a couple of little lines just there. That's a line called our sacroiliac joint. That's at the very, very bottom of the spine. So
sometimes called the SI joint for short,
SI joint,
yeah.
So much easier to say than sacroiliac joint, So we have those 3 main sections. So a lot of people think the spine is straight, but it's actually a very, very gentle S shape.
And then is the tailbone, the coccyx, right at the bottom, is classed as part of the spine as well?
Yep, so we have the sacrum, which you can see just here, and then the coccyx, which is at the very, very bottom just there. So that moves, the whole of the spine just there.
And does each section have a different job then, and how does it all work together?
Yep, so we have each bit of the spine will move in different ways. So we find a lot of the movement comes both from our neck and also from our low back. So we tend to find that generally this middle section of the back will be a little bit stiffer, but we have the discs, which are these little structures just here, and they are in between each vertebrae. So what the discs do is they allow for movement within the spine, they shock absorb, so when we're in different positions, they will adapt to that. We also have these joints just in between each of the little vertebrae there. These are called our facet joints, and what they do is they allow for movement. So our spine can move in lots of different ways, and that is down to the joints in between each of the vertebrae just there. We also have muscles that run down the side of each of the spines, so they will allow for movement, etc. And just with the anatomy of the spine, we have our spinal cord that passes through the centre. So the main function of the spine is to protect the spinal cord as well. You might see these little funny yellow structures popping out at each level. They're actually the nerves that come from each level as well. So that gives us a little bit more of an idea of the anatomy just there.
Okay, brilliant. So what are the most common causes of back pain? We know it's very, very common. 84% of adults will experience back pain at some point. What are the main causes?
So there's two main causes. First one is we can actually injure our backs. So you'll hear the classic scenario that people bend down, they twist in an awkward way. I've just come back off holiday. That's a very common one, getting your suitcases in and out of the boot of a car because you're in a bent and a twisted position. So with the anatomy of the spine, we're much more susceptible to injuries when we're bent and when we're twisting. But the majority of people with back pain will actually be doing day-to-day things that they're not aware of. So I call it the silent assassin. So these everyday things, how we're sitting just now, a lot of us are very sedentary with work. We're sat at computers. Laptops are definitely a very bad culprit because we're hunched over.
Sat like that,
yeah,
aren't we, slouched?
Yeah, so what we find is every day will cause little bits of stress on our back that can be very accumulative. So we only start to become aware of what we're doing when we start to get a few little niggles and a few little warning signs. But a lot of people will ignore those warning signs. So then it'll be something very simple like picking something up off the floor that triggers the back pain, but that's not been the cause, that's just been the trigger. So
it's like the straw that broke the camel's back.
Yeah,
well,
literally
actually,
the straw that broke the camel's back, yeah. So yeah, it's these day-to-day things that I don't think we're always aware of that we're doing. And I would say from my experience that most people do the damage when they don't have the back pain because you're not aware of it at all.
Sometimes we talk about lower back pain and upper back pain, and we've looked at the spine, but what are the main differences between the two?
So we find with the upper part of the spine, so the neck and this middle section, a lot of problems in that area tend to be postural. So again, I think most of us work from computers or for a lot.
It's called tech neck, isn't it? This.
Yep. So we're looking down a lot. We're in the one position, and that puts a lot of stress on the spine. So you'll tend to find that with this upper section of the spine, that's more postural type issues. With the lower part of the back, because we do get a lot more movement there, so we're bending down to pick things up, we're moving a lot more in that area of the back. And we have very, very deep muscles, so our core muscles that help protect the spine. So if they become, again, weakened or they're not working properly, then that's where this area of the back will be a lot more susceptible to problems. So yeah, tends to be more postural in this part. Lower part tends to be more just down to everyday movements that we do.
Okay. And then what would be some common symptoms that people will typically experience when they're having back pain?
Again, can be very, very varied, as I'm sure you'll appreciate. I find that what a lot of people do is you'll start to get these early niggles. So you'll maybe find you start to get a few twinges in the back. You maybe get a little bit more of a constant ache within the back. You might find, for example, you've been sat down for a while and the back is just starting to get a bit stiff and a bit achy. But I call that the flying under the radar pain. So this is where it's there. It's maybe very low on the scale and most people tend to ignore it.
Just put up with it, take some painkillers and get on.
Or they'll
Very
think,
British.
it'll ease in a few days, it'll ease in a couple of weeks, and then it just continues to escalate. So in more severe circumstances, we can find that the pain can be a lot higher. Sometimes we can find we'll start to get a bit of pain radiating down the legs or down the arms if it's coming from the neck. So yeah, the symptoms can be very, very varied. So I think the main problem is people do ignore those early warning signs.
Yeah, guilty. I definitely
I think most of us are.
Yeah. And what about red flags that people should be aware of? So things that suggest, this pain could be more serious.
Yeah. I think the first thing I always say is if it doesn't feel right, trust your gut.
Yes.
Because I think we know what feels just like a bit of back pain, but we know when it feels more than that. If you're getting constant pain, so if the pain just isn't going away, it's there all of the time. If you're getting the pain at night time, that is a red flag. That's one thing that you really, really want to look out for. If you've lost a lot more weight than you would normally expect to lose, or you've not been trying to lose weight. If you've got any problems with your bladder or bowel, as physios, we always ask these questions routinely, and people don't expect there to be a connection between your bladder and bowel and your back. But we have a little bundle of nerves right at the bottom of the back called our cauda equina. And if we get problems with the discs right at the bottom here, that actually puts pressure on the cauda equina and it can actually impact your bladder and bowel function. So we ask questions, any difficulty actually going to the toilet, so you feel like you maybe need to go, but when you go, you can't actually
can't get
go.
started,
Yeah,
yeah.
you can't initiate that, or you've lost control of your bladder and bowels, you maybe had any incontinence. You can get numbness in what we call the saddle area.
Yeah.
So I asked the question, can you feel that any change when you're wiping yourself after the bathroom?
Yeah.
So any signs like that are very urgent signs that you need to get that looked at immediately.
Yeah, 'cause I guess if that's left to get worse and progress, you can end up with you don't want permanent damage. to those
Absolutely.
nerves.
And I think it's one of these things that a lot of people don't associate it with the back. And the advice that we would give anybody with any of those symptoms is you do need to attend A&E immediately. Just as you said, Zoe, if it's being left, then it can cause permanent damage. So you want to really take note of any of those symptoms.
And can those nerves affect sexual function as well?
Yes, so that's one of the questions that we would always ask as well. So we ask about any sexual erectile dysfunction. And again, there can be lots of other causes of that, as I'm sure you'll appreciate. But when you start to put all these pieces of the puzzle together, that's when you would always want to make sure that somebody's getting checked over.
And I guess if there are other things going on as well as the back pain, you know, if you've had a traumatic injury, if you've got a fever, if you feel unwell, all of those things make you a little bit more cautious, don't they?
Yeah,
And
definitely.
worth
And
getting
I think
checked out.
it's putting it all into context as
Yeah.
well, isn't it? I think sometimes you'll have someone that maybe you have to be very careful that people don't downplay back pain.
Yes,
You can get people who are very maybe overplay things, but often the people who have maybe the more serious conditions are very much underplaying it. I always call, we have these physio spider senses, and you can just tell when something doesn't feel quite right. And I think often the person who has the problem can do exactly the same as well. They just feel the gut instinct that something isn't quite right there.
And I think back pain can be so up and down, and it always seems that if you go and see a professional, it's when you're having a good day. So it's important to tell them not just what you like today, but how it is at its worst as well, isn't it? So you get that full
Absolutely,
picture.
definitely.
Well, moving on to treatment options then, if somebody is living with ongoing back pain or they have a history of back problems, what should their first step be?
I think the first step is always get advice from a professional, because just as we've discussed, a lot of people have this flying under the radar pain, and if you don't address it in the earlier stages, it can escalate and it can take a lot longer to settle down as well. So most people, with the right advice, 90% of back pain will settle within a few weeks, and it is just by doing the right things. It's, you know, taking pain relief if you need to, movement. A lot of people feel they just need to sit and not move, which is one of the worst things that you can do for your back.
Is that because the muscles then tighten up as well, and it can then give you sort of double the problem?
Yes, everything just stiffens up when we're in the one position. So the way I always explain it is, if you've been in the gym and you get up the next day and you feel that you've been doing some exercise, everything's just really stiff.
Yes.
If you sit and continue to sit, that stiffness will just get worse, whereas movement is actually the best thing that you can get. So if you speak to a physio, for example, we can give you some gentle exercises, some gentle advice, just to get things moving. And as I said, we'll find that the large majority of people will settle within those early stages with that early intervention.
I think it's so true that we're often inclined to just put up with it and think, oh, you know, I'll put up with it for a little while and see if it gets better and take some painkillers. But what you're saying is actually the sooner you have an intervention or you see a professional and they give you that advice and that reassurance often, isn't it? That keep moving, you know, here are some things you can do. The reassurance is really important.
Absolutely.
So what does that initial assessment usually involve?
Okay, so what we would do as physios is we try and get a little bit of an overview of the pain. So going back to the red flags we were talking about before, we need to first of all make sure that it is just a simple episode of back pain. We need to make sure there's nothing more serious or nothing more sinister going on. So we would go through a lot of screening questions, get an idea to do with the pain, and then we would make sure that we're giving the person the right advice, advice on pain relief, gentle exercises, things that they can do during the day to help them. So our job is to get that initial guidance, but also to make sure that there isn't anything more worrying going on that we maybe need to then refer on to get things looked at in a little bit more detail.
And this is usually done virtually, isn't it? So, you know, you can actually get in touch with somebody. You don't even have to move. You don't have to get in the car and drive. You don't have to travel. But are there times when it's better to have a face-to-face appointment rather than a virtual virtual one for that initial consultation?
I mean, certainly we would always suggest starting with virtually just for ease of access. So if you're waiting to see somebody face to face, particularly your GP, you might be waiting for a little bit longer. So in some instances, yes, we can manage that all virtually. But if maybe the pain's a bit higher, or you're maybe starting to get a bit of referred pain down the legs, then what we would do is then refer you onwards then to see somebody face to face. We're very wonderful people. We can do a lot virtually, but then sometimes just seeing someone face to face is always going to be the better option.
But the key thing is early intervention, getting that advice early, and if it's virtual, then usually that's more accessible.
Yeah, absolutely. And I think it's just that logistically, it's a lot easier for people as well to get that virtual advice rather than going physically to see somebody face to face.
Does back pain always or usually eventually mean back surgery?
Not at all.
Good.
Yeah, I think when you look at the statistics, the percentage of people needing surgery is absolutely tiny. And again, the way I explain it is if you went to your GP, if you had pain, you wouldn't go to your GP and be straight away put onto like morphine, which is a very, very strong painkiller. Your GP will try you on the ibuprofen, the paracetamol, maybe then move up to your cocodamols, your naproxens. So there's almost like a triage, like a ladder of way things work. And it's exactly the same with back pain as well. So because back pain is very complicated, there's lots of different factors that can cause it. Even if you needed something like surgery, that isn't correcting all the other factors. So the percentage of people needing surgery is very, very small, and it's generally way down the line. Once you've had physio, you've tried lots of different things, only in that case, if there's maybe something structurally with the spine, would you maybe need to consider something surgical.
And I think most people do see surgery as a last resort if it's absolutely necessary, and rightly so, except for those rare cases where, you know, it is something like cauda equina or something really serious. So what are the pros and cons of surgery, finally? You've kind of mentioned some of the cons there.
Yeah, so sometimes with the pros, it will be, for example, just referring back to the back here. So if we have problems with the discs and if the discs are actually pressing on the nerve root, so that's where we would maybe present with, everyone calls it sciatica, pains down the legs, pins and needles, numbness. If that just is not improving, you've tried your physio, you've tried different types of treatment and it's still not improving, then that's something where surgery could be an option. So what they actually do is they take a little bit of the disc away that's pressing on the nerve, so you're taking away that causative factor, but then you're always following that up with the lifestyle, with the exercises, etc.
Otherwise it can recur, can't it?
Absolutely. And I think people think that surgery is the fix. It's not the fix. It's the start to creating the fix.
Rebecca, thank you so much for that. That was really insightful and really helpful. Thank you.
Thank you.
Okay, so we've looked now at diagnosis and briefly covered some of the treatment options, but what does that look like in practice? Sometimes it can feel like having a dodgy back is just a part of life, but there is hope. Many of us are able to reduce or even eliminate pain by focusing on exercises, support and lifestyle changes. And that was certainly the case for our guest today, Jenny, who suffered from serious back pain but has now made an impressive recovery. Jenny, thank you so much for joining us today. Jenny, could you tell us first of all, how did your back pain first start?
Started about 5 years ago. I've got 3 children. And I think it's probably one of those things that I'd kind of put off. It was, you know, I started having a little bit of a niggle in my back, started to get a little bit worse, and I thought I needed to do something. So I got referred by Bupa to see a consultant and had an MRI scan. And they said that, you know, due to my age, I had some degeneration, but there was nothing serious wrong. It was just, you know, an age thing. But again, they recommended that I see an osteopath, which I did. I saw an osteopath on a number of occasions and they fixed the problem. There and then it was great. Really, really worked for me. Fast forward, and there were certain things that the osteopath had said to me and recommended that I did.
Exercises type?
And Pilates. And stretching. And I've got to say, Zoe, I didn't listen because they treated the pain and the pain went away and I went on with my life.
Well, I think that's often the way, isn't it? If the pain's better, you think, oh, I'm okay now, I don't need to do that anymore. I see that all the time with patients.
And then it got to last year and I actually thought there was something seriously wrong with me because this back pain had come back and it was making me feel that, you know, I wasn't sleeping properly because I was worried about the pain. So I got referred to a spinal consultant who said the same thing, that, yes, Jenny, there's nothing wrong with you. You've got a little bit of degeneration, but it's nothing that we wouldn't expect at somebody of your age. You need to go and see somebody about this. You need to go and have some physio. So I saw a physio. I didn't get on particularly well with the physio. I think they were more of a sports physio. I did see the consultant again at the start of the year, and they did an injection in my SI joint. But at that point, that was the crux where I thought, I've got to listen to what they've said. I've got to do the work. So I managed to get an amazing physiotherapist through Bupa, who taught me all the exercises and introduced me to Pilates. So had I listened 5 years ago to what my osteopath had said, I probably wouldn't have been in that position. So yeah, that's my journey since 5 years ago.
And how bad did the pain get? Yeah, how was it affecting your everyday life when it was at its worst?
So it was more when I was sleeping, so turning over in bed, which meant I was having disturbed sleep. Disturbed sleep then means that, you know, I wasn't the nicest of wives the next day or the nicest of mums, so I'd be tired. Yeah, well, more irritable than normal. Yeah. But it was exaggerating, the pain was exaggerating my mood. Yeah. So yeah, it was affecting my sleeping. I then kind of didn't want to do what I loved doing, walking, because it was like, oh, well, is that going to hurt my back? So I was starting to kind of withdraw from some of the things that I love to do and be.
We know that there's a really strong correlation between back pain and mental health, whether it causes stress or low mood or even fear. Like you were saying, the fear of going out and walking, would it make it feel worse? So would you say that it did impact your mental health?
Yeah, and just so much that my sleep was interrupted. I was worried about the pain. I didn't walk, and I know walking is what I do is really, really good for my mental health. Yeah. You know, I'd withdraw from my friends, so going for a walk with my friends and chatting the day away. So it did start to affect it. It started to affect my mood. You know, my husband would say to me, "What's wrong with you?" It was like, "My back's hurting." Yes. You know, and it's well, and for, you know, he's very, very, very supportive, but it was like, don't do something about it. Yeah. So, you know, it was affecting my life.
I mean, I'm nodding along because I can relate. We were chatting earlier. I've had a back issue myself for the last couple of years, and I have a 4-year-old. So since he was 2, I've had back pain, and I think it mutes who you are as a person to some extent. I know with me, I've got quite an outgoing personality. If we're out for a walk, I'm the sort of person who will just randomly jump off things or jump over things and be a bit silly. But, you know, with my child, he's never seen me do that. He jumps all over his dad and they play fight, and he knows he has to be a little bit careful around me. And it breaks my heart a little bit, actually, that he almost doesn't know the real, true me, because I've always been a little bit apprehensive around doing certain things. So it impacts you. I think it impacts you in more ways than you would expect it to, doesn't it?
Well, you become the person that you didn't think that you was going to be. Again, like you, I'm outgoing, you know, I'm bubbly. It's not like me to be not bubbly, I suppose, if there's an unbubbly word. It's not like me to be like that and to be quite negative about things when, you know, my back issues were causing me to be quite negative about things. Not because I was negative about life, it was just, this is really, really hurting and I want something.
Every day is just that little bit harder, isn't it? Just getting through the day, keeping your energy up is more difficult,
Absolutely.
I always find. You mentioned that you had some pain, sort of milder, you said niggly pain, I think, for a while before you did anything about it. And we hear that quite often. What was it that was holding you back? And then eventually, what was it that made you seek some support?
I think it was just life getting in the way, you know, work full time, kids, husband. And I think stupidly, you think, well, actually, it'll just go away. I'll just have some tablets, won't I? It'll just go away and, you know, let's have some ibuprofen or whatever it might be. It will go away. But it's when it then started to kind of affect me more I thought, it's not going to go away. There's something that needs to be done.
Yes.
You know, had I known at that time the stuff that needed to be done was some self-work, like I say, I probably wouldn't be where I am today. But it was that initial, I need to go and get something done because I'm becoming the person that I'm not, so to speak.
What would you say to yourself if you could go back and speak to yourself 5 years ago when you just first started getting that little bit of discomfort? What would you say to yourself?
Oh, I would absolutely 100% say to me, do the exercises that the osteopath has said, you know, that I should do. So go and do some Pilates, and join a proper class, do that, do some stretching. They'd have also said that, you know, because I sit down in my job all day, you need to take regular breaks and you need to stand up.
Yeah.
I'm not saying I don't think, I know that I didn't listen, Zoe. So we're all guilty of kind of hunching over a desk for 8 hours and going for your lunch hour and stuff like that. I say to myself, I need to listen and I need to do the work, I need to put in, because the therapist will relieve your symptoms. There's other stuff that you need to do, you need to put the work in.
So now that you know all of this, how easy do you find it to stick with it, to do the stretches, the exercises, the Pilates, the getting up? Do you just manage to do that easily now, or do you have to motivate yourself?
I mean, it's a non-negotiable.
Yeah.
So I've got like a little timer where I set that I need to stand up now.
Yeah.
We've got stand-up desks at work. I've got stand-up desks when I work from home. And my non-negotiable is the Pilates, even if it's just once a week. Yeah. Or even if it's that I go into the gym at work and just do some stretching. I think people automatically think that, you know, you've got to have your gym gear on to do some stretching. You can go in and, you know, stretch without getting all kitted up in your gym gear. So those are my non-negotiables now. And I wish I'd done it sooner.
Yeah. I think the journey of having a back problem can be long, and treatment plans can be long. And I know from my own experience how demoralising it can feel. So if there was somebody out there who's on this journey and they're just feeling overwhelmed, what advice would you give them?
We just need to go and seek some help.
Yeah.
You just need to go and, you know, speak to your doctor, get a referral. Don't suffer in silence, because I think the longer you leave it, the more chronic it becomes, and then harder to treat, because you're thinking, it's going to take me ages, and I've not got time for that. But if you kind of nipped it in the bud when in its early stages, you'd have got to do them exercises, and then it wouldn't turn into something that's long term.
And I think sometimes something that people perhaps aren't all that aware of or don't think about is, once this back pain becomes ingrained, the mental health side of it, the stress and the fear, that can actually make the pain worse, and you can get into this vicious cycle. And that's why I know when we speak to the experts, the physios, the osteopaths, they always say the sooner you can nip this in the bud, the better, and then you can save yourself from so much pain. I think, Jenny, to summarise, what would you say your top tips are for somebody with back pain?
So do the exercises, do lots of stretching. Just maybe another top tip that my physio had said is crossing my legs. So don't cross my legs. So keep my feet planted on the floor. You know, naturally, you know, we when you're sitting on the sofa and you're relaxing, you pull your legs around. Well, I used to, and I don't. I sit with a little puffy in front of me, and take those breaks when you need to stand up.
Okay, well, I've sorted myself out. Finally, how are you now? How is your back these days?
Yeah, it's really, really good. I'm still having some pain, but I think that's probably because I've left it for 5 years. I'm still seeing my consultant just to make sure things are in check. But compared to where I was a year ago, I'm in a much better place. And I know by doing the work and the Pilates, it's only going to get better. I feel like when I come out of my Pilates class, I feel like a new woman.
Yeah. Yeah, well, that's enough. That's the motivation you need, isn't it?
Exactly.
The way it makes you feel. Thank you so much. What a turnaround. Amazing. It's always really great to hear a story like this where it's honest that you've got to do the work.
Of course.
But if you do the work and you're willing to commit to it, then you can feel so much better. So thank you. I really hope that Jenny's stories dispelled the idea that once your back starts hurting, it's only going to get worse. So let us know what you thought in the chat. Share your thoughts, share your questions, and we'll come on to them at the end. Now I'm joined once again by Rebecca and also by Marco. Marco is a highly experienced advanced practice physiotherapist and clinical spinal specialist, having spent over 13 years working with patients. So welcome, Marco.
Thank you for having me.
A big problem with managing back pain is that there are actually loads of really unhelpful myths out there. So we're going to quickly bust some of them for you now. I'll read out some statements and our guests will tell us if they're true or false. And if you are watching live at home, you're welcome to have a go yourselves. Just use the emojis below the video box and give a thumbs up if you think it's true or a thumbs down if you think it's false. So let's get started. I love a good myth-busting session. So the first one is rest isn't actually best if you're suffering from back pain. We'll pause for a second for the people playing along, and that question goes to Marco.
Correct. So initially, if you have acute pain or an acute injury, then rest is good for a few days to let natural tissue healing occur. But if we stay inactive for too long, we can develop muscle spasms. Muscles can actually get weaker if we revert to what we know as bed rest. So we want to stay moving as much as we can. And the old saying, movement is medicine. It gets your muscles acting, contracting, relaxing, and preventing pain.
And just to add to that, in our research, 50% of people say that exercise helps them manage their pain. So that absolutely backs you up in real life as well with real life people. So thank you for that one. The next one, this one's for Rebecca. A neck or a back brace is a good choice if you're in pain. What do you think at home? Do you think it's true or false? Rebecca?
Definitely a false for that one. I think back in the day, back in the 80s, I think people did think that braces were the right thing to use. So you'd see people with whiplashes and these big collars around the neck. But all it does is it actually exacerbates things because you're not moving, so everything stiffens up. And as Marco's just said, movement is always medicine. So yeah, definitely a false for that one.
Okay, and I think it's really good that we're highlighting that because when you have pain, your brain, you're trying to protect your body, aren't you? And pain makes you think danger, something's wrong, and you have that fear of movement making it worse. But it's really important that people are reassured that just gently moving, keeping the muscles active is actually a good thing to do. And if you need to take some painkillers to be able to move around a bit, that's fine as well.
Definitely.
Okay then, next question. You don't need a scan to properly diagnose a back pain problem. What do you think at home? You don't need a scan. Is that true or false? Rebecca?
That is very much true. I think subject to contrary belief, I think a lot of people think that they need a scan to tell them what is actually going on with the back. But I always explain there's not a big white arrow on an MRI scan telling you where the problem is. So there's a lot of information that an MRI scan doesn't tell us in terms of movement, stiffness, weakness in the area. So it's just one part of the picture, and you definitely don't need a scan to tell you what's going on with your back.
But despite that, do you find often your patients are asking you for a scan?
Yes, every person pretty much. Again, I think it's just that misconception that a scan will tell you what's wrong. The only time that I would recommend a scan for someone is if, well, first of all, if there's something suggesting there's something wrong, serious going on with their back. But sometimes people have this very deep-rooted fear that there is something underlying with the back, and that can actually prevent them from their recovery. So sometimes just from a reassurance point of view, it can be helpful. But again, it is just one part of the picture.
And I know something I've learned, Marco, from my own experience, is that you can have, in some cases, lots of things going on an MRI, but a person's absolutely fine. And then you might have an MRI that's pristine and the person's got loads of issues with their back. So often there's no correlation, is there?
Absolutely. And if you're in clinic, you have to look for that correlation on the scan and to the symptom presentation.
Okay then, next one, good one for you, Marco. Lower back pain is caused by having a weak core. Have you heard that before? Do you think that's true or false? Marco?
So this is false. So people who have back pain actually have quite a strong active core because it's protecting your body from moving in different ways. So the muscles are very protective and contracted. And what we want to do is teach those muscles to relax, to improve the movement, again, so those muscles can contract and relax in their normal design form and prevent any other muscle spasm around the pelvis or the low back.
I think we're often told, especially if we have back issues, to do things like Pilates because it strengthens the core. So is that still right, or is that not
Absolutely,
right?
it's important to have a strong core, but we don't need to focus on a single muscle group. We have to look at the whole muscles, all of the muscles that support the spine, and the core is an important part, but a weak core does not correlate to back pain.
Okay, really good to know. The next one, once you've hurt your back, it will always be a problem. What do we think? True or false? What do you think, Rebecca?
Definitely a false on that one as well. Again, I think people like that quick fix, but we have to look at the long-term picture as well. So we always give the right advice on exercises, movement, long-term management. And if people stick to that, then certainly they can get on top and manage their back pain and not necessarily have any further problems. When it becomes recurrent, it's generally when people ignore all that advice and don't do all the things to help themselves, and then you are going to be at more risk of having further problems.
I know I've seen that so many times with my patients, that they sort of get on top of their symptoms with their rehabilitation programme, and then they stop doing it because they're better, and then it comes back.
Yeah.
So it is kind of a lifelong commitment, isn't it, to keep your back
Definitely.
healthy if you've had a back issue.
Definitely. I think that's part of our job as clinicians, is to educate people about that as well, because just as you said, Zoe, otherwise the back pain goes and everything goes out the window, and
Yeah.
they just get back to their old habits.
Exactly what we saw with Jenny as well earlier on. Okay, thank you both so much. That was really great. For all of you watching, was there anything there that surprised you? If there was, please do tell us in the chat. As we've discussed, rest is not always best. When we've had pain, it's understandable that we might feel afraid to move, and we can start overprotecting our back. But really, as the guys have said, movement is medicine, and it's the most powerful tool that we have against the pain. And that's not just preventing it, but treating it as well. So with that in mind, it's time to move on to the next part of our clinic, which is all about rehabilitation. So Marco is going to be getting me moving with a few stretches. And of course, it's not just for my benefit. These stretches are great for back pain relief, and they can support recovery as well. So if you feel like it, you're welcome to follow along or try them out. But no pressure, we will be sending you a recording of today's event, so you'll be able to watch back later. And you can also find lots more back pain exercises on the My Bupa app. Welcome to our rehab room. Now, as I said, Marco is going to be taking me through a few simple exercises. So he'll show me what I have to do before I have a go myself. And Marco, you're going to share with us some gentler versions of each exercise as well, aren't you?
Yeah, absolutely. Give you some regressions and also some progressions as well.
Okay, great. And we've got some equipment here, but that's just to make it look nice. You don't need any equipment, just yourselves to give these exercises a go. So what's the first one?
So to start off with, really basic exercise is knee rolls and knee hugs. So this is really beneficial to get you started if you're in an acute flare-up of pain.
Okay.
So we'll start on the floor, or a flat surface like your bed if you struggle to get onto the floor, with your knees bent to about 90 degrees, and you're just going to gently roll your knees from side to side, just feeling a bit of stretch in the lower back,
Actually feels quite nice.
and going as far as you feel comfortable to do so. When you come back up, you can hug one knee into your chest, or if you feel really confident, you can bring both in at the same time and feel that stretch in the lower back.
Yeah.
And then put your feet back down to where they were. And then you repeat that movement.
And how does this help if you've got back issues?
This just encourages your muscles to relax, contract, come out of that spasm, and hopefully regain a little bit of normal movement, as well as mobilising the spine in the areas that it should be mobilised.
Okay. And what's the gentler version for people who, I guess if you're in an acute phase of back pain, that might be a bit tricky, getting up and down off the floor? What could they do?
Absolutely. So you would do that into a chair. So come off the floor, find a nice comfortable seat to be in, and then you can just rock your legs from side to side, feel that twist in the back, bring your knees up into your chest as well.
Okay. And how often should people do this? How many repetitions?
We should do exercise as we feel comfortable to do so. So approximately 5 to 10 or 15 repetitions, aiming to do that 1, 2 or 3 times, but generally listen to your body. Do what you can, don't push it.
Okay, so that's a good one. What's the next exercise?
The next one, we're going to go into some classic yoga moves. So child's pose into cobra. So starting on the floor with your hands and knees about shoulder width and hip width apart. and then you can gently rock back onto your heels, stretching your arms out in front of you and feeling that stretch through the whole back, allowing your head to drop down to the floor.
I'm getting a few creaks and cracks going on. Is that okay?
As long as it feels nice, then it's fine.
Yeah, it's kind of a bit of a relief. So how is this one helpful?
So this allows your lumbar spine to go into a bit of flexion, it stretches your muscles, and it relaxes any muscle that might be into a spasm.
Okay.
From here, we come back up, we drive our hips towards the floor, lean forwards, look up towards the sky, keep your shoulders down, and at the top, take a really deep breath out.
So this is one I still struggle with a bit, but when my back was really bad, if I tried to do that, say from the ground, I was just like this, my back just wouldn't bend.
Yeah, so
Got a lot better.
by pushing up and taking a deep breath out really allows your spine to sink into the floor.
Yeah.
And I'd say don't stay here too long, transition back into your child's pose so you can combine the movement.
Okay, all right. So what about people who struggle with that? How can we make that a bit easier?
So you can make that easier by coming into a 4-point cat-cow. So back up into your starting position and then allowing your spine to just gently curve, tipping your pelvis forwards, and then the opposite direction, pulling your belly button up towards the sky, rounding your pelvis into that position.
Okay. Yeah. And how many of these would you do? Is this something you do every day if you can?
You would incorporate this into your exercise routine. So generally mobility exercises you would start with to loosen the spine up before you then go into your strengthening routine. And repetitions again, 5 to 10 repetitions, doing what you feel you can manage.
Okay. Oh, what's the next one?
So going into the next one is the bridge. So laying on your back with your knees bent and your feet on the floor with your heels in contact and your toes raised. By raising your toes, you put more load through the hamstrings and the glutes.
Okay.
From here, we're going to pull our heels into the floor, squeeze our buttocks, and just raise your pelvis off the floor, and then relax back down. Try not to push your spine too high up towards the ceiling. This is something we see quite commonly in people who have back pain. They use their back through this movement.
Is it sort of like this? There is a temptation to just lift up to there, isn't there?
Correct.
Okay.
So just squeezing the buttocks, that will flatten your spine, pull the heels into the floor, and feel the muscles in the back of the legs working.
And I mean, I know I've got really weak glutes with my back issue, and I can feel them shaking just doing that. It's a tiny exercise, but that's a strengthening exercise, then I take it. Is that the benefit?
Yeah, strengthening exercise for your hamstrings and your glutes.
And how can we make that a bit more gentle for people who are struggling or in a lot of pain?
Keeping the movement very similar, you're just putting your feet flat on the floor and bringing the heels a little bit closer to your bottom.
Yeah.
And then repeating the same movement, squeezing the buttocks and just raising up.
Okay. And how often would we want people to do this one again? Is it same as before into your regular routine?
Yeah, there's no set hard or fast numbers for your exercises. It's what you can do comfortably. So if you get to the higher ends, 15 repetitions, and it's painful, reduce that down to 10. But generally 5 to 10 is a good starting point.
And if you're doing it for the very first time, should you just start with 5, just a low number, and see how you feel?
Don't jump in at the deep end.
Yeah.
Start off nice and easy and gradually build up.
That's what I think sometimes can put people off, isn't it? Because if you don't do much, something like that is actually strengthening your muscles, if you do quite a lot of it, it's actually normal to have a bit of pain and tenderness for a few days, isn't it? Because that's the muscles building, and that can get confused with the other symptoms you have.
We commonly see people come back and say the exercise has made my pain worse, which is a good thing because we're targeting the right areas. So we just need to regress that, reduce the capacity, and then progress over time.
I always say to my patients, look, if you're working with a physiotherapist and they're guiding you and it's a bit sore afterwards, it's fine to increase your painkillers, take some painkillers on those days to enable you to do the exercise.
Definitely. Use your medication to help you do your rehab.
Yeah. Okay, we've got one more exercise.
Going into a squat, so a bit of a harder exercise to do. So stand in with your feet about hip width apart. Hands out in front of you really gives you a nice control and balance. And then we're going to just try and sit down as far down as we can go towards the floor and then come back up.
That's a nice deep squat you're doing there, Marco.
If you feel that your back starts to bend, stop
like mine
there
does. Okay.
and then come back up.
Okay. And what's the benefit of this?
We're loading in a weight-bearing position. We're trying to put as much resistance through the quads, the hamstrings and the glutes. This is a full body exercise.
And how can we make that one easier for people?
Again, accessing a chair, so
Oh,
sitting
yes.
down and starting in the seating position, and then just coming into your standing position without using your hands and lowering yourself back down. The chair gives you the beauty to have a little rest and take the load off.
I love that you're doing sit stands. I recommend sit stands to all of my patients all the time. If they're starting off with any form of exercise to try and get a bit of strength, sit stands are a really good way, aren't they?
Lower limbs and the strength in our lower limbs are the foundations for our spine. For longevity, we need to be strong in the legs to support the back.
And for someone who is just starting out, how many should they try and do initially, and what should they work up to?
Start at numbers that you can feel the exercise working. If you can't feel the exercise working, it's unlikely doing anything. So if you feel your muscles working at 5, stick to 5 until it feels easy, and then progress up through the numbers.
And you're starting to get ever so slightly out of breath there, aren't you? Just a teeny tiny bit. Me too. So these exercises, they do make a difference, even to people who are super fit. If you gave those exercises a try, or if you have any tips, then please do share them with us. Anything that helps you get a bit more movement in, we'd love to hear it. So those are some basic options, but it's always a good idea to speak to a professional about your specific concerns. That way you can get a personalised programme that's perfect for you. Bupa customers can speak to a physio easily via the My Bupa app. But now on to the most important part of any consultation, and that's answering your questions. Well, you've been sending lots of comments and questioning, which has been fantastic to see, so thank you very much. Rebecca, Marco and I will get as many answers for you as we can. So first up, I can hardly sit with my back pain. Do you have anything that will help? Marco, do you have any suggestions here?
So simply, if you can't sit, try not to sit for as much as possible. But if you are required to sit with your role or work or whatever it might be, then
Driving as well.
Exactly, yeah, or commuting, then trying to adjust your sitting position, either putting a towel behind your back or a rolled up jumper, or making sure that your feet are quite flat on the floor and your hips aren't below your knees. And regularly moving, so even just sort of moving your knees towards your chest or rocking yourself from side to side.
Okay, so lots of, again, it's what we keep saying, isn't it? It's keeping moving, variations of sitting that involve a lot of movement can
Correct,
help alleviate it. Rebecca, this person says that sleeping's been a real issue since their back started hurting. And I actually have a stat here from Bupa's own research. Roughly 1 in 3 people with back pain experience either difficulty sleeping or poor quality sleep. So do you have any advice?
Yeah, absolutely. I mean, I think certainly if your sleep is broken and with pain, then taking some pain relief before bed can be helpful, just to help make things a bit more comfortable. I think a lot of it is getting a comfortable sleeping position as well. So we don't want to have a super soft mattress. You want to have quite a firm, supportive mattress. That can make a really big difference. Using pillows to give you extra support as well. I think the most important thing is finding a comfortable position. So if you're not comfortable, then you're going to be quite fidgety through the night. So you might need to use, as I said, that little bit of extra support as a short-term measure, just to make sleep a little bit more comfortable for you.
I know my position I found was lying on my side, but having one of my pillows under, like sort of in the, what do you call the position? Like,
yeah, the fetal position.
Fetal position,
yeah.
But with my bottom leg straight and my top leg on a pillow, so my pelvis was kind of straight.
Yeah. And I think when we're sleeping, this is the problem. Our spine won't be kept in a straight position, and particularly with our pelvis as well. So yeah, just finding that comfortable position for you, using a little bit of extra pillows to support in that position as well.
Okay, great. Next one, we've had quite a few questions about different types of pain relief. So we thought we'll just put it all into one question. And Rebecca, what are the best things for short-term relief versus long-term relief?
Well, certainly for pain relief, over-the-counter medication can be very, very effective. When I'm speaking to patients, I try and give them a little bit of a scale with their pain. So as physios, we often ask the pain out of 10, with 10 being the worst and 0 being no pain. So I give the description that if your pain is becoming below a 5 out of 10 with any pain relief, that pain relief has probably been effective. So if you're taking the over-the-counter medication and it's not taking you below that 5, then that's generally what I recommend. You probably need to speak to your GP to get something a little bit stronger, or even speak to the pharmacist, because again, over-the-counter, you can sometimes get something that is a little bit stronger. But if you're taking over-the-counter medication for a longer period of time, that's definitely when you need to speak to your GP, because we just want to see if there's just going to be something a little bit more effective. I often recommend the use of heat packs or even cold packs to patients as well. So particularly for something a little bit more long term, that can be very, very effective. And again, we always get asked the question, what's better, heat or cold? Again, just like Marco said, I would use trial and error and see what works for you, but certainly they can be very effective for longer term pain relief as well.
Yeah, and obviously as a GP, I often see patients for pain relief. I usually say to patients, look, if you're taking something like paracetamol, ibuprofen over the counter and you're taking it every day for more than 2 weeks, at least let your doctor know so that you can have a chat about potential side effects, look out for side effects, because things like ibuprofen can cause gastric issues. Depending on the nature of the pain, if it's nerve pain, then there are other medicines that can be useful for some people but not for others, a bit like you were saying, Marco, with the other therapies, and they've all got side effects. So it can sometimes be a conversation, making sure you're making an informed choice, I think, about medications, especially when it comes to longer term things. But there's no harm in trial and error. So we call it a pain ladder, don't we? We start with the over-the-counter things and we sometimes need to build up. But some people will try something, it's not working, but stay on it for months and months and months and months. If it's not working, it's not worth continuing to take, and it's worth trying something else. So don't be afraid to chop and change a bit with the support of your GP if necessary. All right, so the next one, quite a bit of mention on the chat about steroid injections. Rebecca, could you tell us a little bit more about that?
Again, I think steroid injections are one of these things that you would go and try if you tried all the other things and they're not particularly helping, so a bit up the ladder. And steroid injections can be very effective in some cases, but it's giving you that short-term window. So I always say with any steroid injection, it's really giving you that window of opportunity to settle the pain, to then get on with doing the exercises and the rehab. So if you've got something that is very, very irritable and you're unable to get the pain under control, the steroid injections can be helpful in some instances. But as we said, it's not just you have the steroid injection and then you just leave things to chance. It's having the injection to then do all the things like the rehab, the exercises, the movement, the posture, etc.
There's no just quick fix. You've got to do the work.
Exactly.
You've got to do, that's what we're learning here, guys. Whatever you do, you don't get out of doing that work, and it's forever, really, isn't it? You're
Absolutely.
thinking about it forever. A person who said, I have sciatica, but I also drive a lot for work. Any tips for long car journeys, Rebecca?
I think the difficulty with people who do a lot of driving is if you're in the office and you're sitting, you can just get up and move about. It's very, very easy to change your posture, whereas it's very different if you're in the car. So I would always advise, first of all, if you're driving for work, it's worthwhile speaking with your employer and maybe discussing a vehicle assessment just to check that ergonomically the car is correct for you. Marco was mentioning before about using a rolled up towel on your back. You can also do that within your car as well. So a lot of cars will have inbuilt lumbar support, so you should be getting that support there. But if you're not, an extra cushion or an extra lumbar support can be helpful. But I think most importantly, you need to plan breaks into your journey. So if you're driving for 4 hours, you want to plan rest stops, get up, move about, change position. And just like Marco was saying before, when you're sitting, you know, you're having a little bit of a move about, you're having a little bit of a stretch. That's more difficult when you're in the car. But I would advise people, if you're at traffic lights or a roundabout, use that as an opportunity just to have a little bit of a move about. You can also try just some very, very subtle adjustments to your seat as well. So there is some evidence that suggests that just that very, very slight change in car seat position can be helpful, because again, you're just changing your sitting posture a little bit as well.
So some movement, even if tiny,
Yeah,
is probably
absolutely.
better than none.
Definitely.
Here's another question that I think will be relevant to a lot of people. It says, since my injury, I've been scared to exercise in case I aggravate it. How do I get back into it safely? So Marco, I think this is something you must see a lot with your
Hear it
patients.
every day. So yeah, everyone who has experienced an episode of pain will have an element of fear going back into physical exercise, whether it's knowing the right things to do, the wrong things to do. And essentially, there is no wrong thing to do. If it feels painful, avoid it and gradually build up. And if it's comfortable, do more of it. So it comes back to that trial and error, test, see how it feels, redo it, progress it each time a little bit further to build a bigger spine health for the future.
And how often would there be a scenario where somebody's got this pain, they try and increase their exercise doing, simple, straightforward things, nothing too crazy, and actually they make it significantly worse? Does that happen?
Absolutely, it can ebb and flow quite a lot, and everyone thinks that your rehab and progression is going very linear, but there will be ups and downs. You might get some really good progression, plateau for a short while, progress some more, have a setback, and that is quite common in any rehabilitation programme.
I know I've seen that with my back. It's been up and down, but fingers crossed for the last few months, it's gradually getting better. Long may that continue. Thank you so much. Those are all the questions that we have time for today, but thank you so much to our guests, to Jenny for sharing her story earlier, and of course to Marco and Rebecca for their wonderful expertise. Before we wrap up, I'd also like to mention some useful resources. If you're a Bupa customer and suffering from back pain, you can have a virtual video or phone appointment with a GP or a physiotherapist through the My Bupa app. And appointments are usually available 7 days a week. So as we've been saying, that early intervention, you don't need to wait to start tackling your back pain. The My Bupa app also has lots more exercise plans that you can try, and they're designed for lots of different experience levels and health needs, so there'll be something there that suits you. Plus, our website has lots of health information on back pain too. So we'll post the link in the chat so you've got it there. Managing back pain is possible, and we really hope that this virtual clinic has helped you to see the options that are available to you with a few tools and tips along the way. And please keep an eye on your inbox too, because we'll be sharing a recording of this video as well, where there'll be lots more advice on back pain and help. And we'd also love to know what you thought about today's event. So we'll be putting a short questionnaire in the chat, and would really, really appreciate it if you'd share your views. Until next time, take care.